Hi, this is Mike Gerstein for the Center for Community Informatics Research, Development, and Training, and I'm in conversation with Susan O'Donnell. Susan, introduce yourself.
Sure. Hi, Mike. I'm at the University of New Brunswick in Fredericton and also at the National Research Council here on the UMB campus.
And Susan and I are going to talk a bit about the future of community informatics. So, Susan, what do you think? What do you think the issues are for the future of community informatics?
Well, I could think about it from a research perspective. I mean, one of the ongoing issues, Mike, is I guess maintaining the ongoing partnerships with communities and the need to do that. I think my own experience. I've been involved in a project for 6 years now, and it looks like it's going to go on for another at least 5 years. Mike, I should tell you, we just got some funding for that. So it's a question of maintaining the research partnerships, keeping them really dynamic, because one of the things that happens is that the longer you work, in my experience, the longer you work with community partners, the more issues come up and it gets more and more interesting.
Hmm.
So I think maintaining those partnerships is one issue. How about you, Mike? When you think about the future, what do you think some of the issues
Well, I
are?
guess I'm not. I'm thinking of it less in a research context and more in terms of research supporting practice. And I see the future as one where communities uh, and where the communities are increasingly enabled by technology, as is our other processes, but communities particular specifically, and that the communities will be increasingly required uh, to become involved in a variety of governance processes, service delivery processes, um, both required and will be requiring that they be involved. I've become involved in the discussion around open government and open government data, and what's clear there is that the governments are in the process of making their internal operations much more open to participation, comment, involvement by the citizens than ever before, which really transforms the nature of government. Problem with that is that unless people at the grassroots become aware of this process, become identify their interests, that the result will be that only those who are already involved will gain a benefit from it. But if communities themselves can recognize that they can be more actively involved in the management of government data and the management of government internal operations, then they can use that involvement to for their own purposes and for their own self development. And information technology is the fundamental platform that allows for that allows for the information flow, that enables the transparency, that allows for the communications, and so on. So I see that as really a very important set of opportunities that can and in some areas I think will have to be realized.
You
Um,
know,
yeah.
that's an interesting one, Mike, because what you're painting is a positive picture with dealing with bureaucracy and government and some how things are opening up and maybe making it more of an empowering process. I think one of the things that I see in the future and one of the challenges is that as more and more of these processes become very bureaucratized, there must be a better word for it, but more and more community groups, communities are required for various reasons to package their information, to present it in certain ways, to create certain kinds of data for funders, for example, that aren't necessarily using the criteria that the communities are interested in. So we have this whole requirement for bureaucratic data that the governments are dealing with. And to me, what that raises are issues around community control of the data, for one thing, how the data is going to be used, and the need for communities to get involved in that. And that whole range of that other project that I'm involved in called First Mile, where you have the focus is on the community control of the infrastructure, but also the data flowing through the networks. How can communities maintain some kind of control over this data and how it's used? I see that as a really interesting question that we're hoping to tackle on our project in the future.
Yeah. I may sound optimistic. I'm not necessarily, but because I think the motivation behind this process of opening is also in part a process of privatization or attempted privatization of various aspects of current government services. So one of the outcomes of opening up your data and opening up your processes is to make them much more amenable to contracting out of various of these activities. So that, I think that's the risk, but the opportunity to engage with that and to take additional control, I think, also exists. I think about the health area, which may be a particular area, but if we continue in the current highly professionalized approach to health service, I think we're going to be, it's generally agreed, I think it's unsupportable in the long term. So the question then becomes whether we either cut back in service, cut back in this professional service, privatize the service, which means that it's only available to those who can afford it, or we develop and design a community-based approach where the community becomes a partner in service delivery, a very important element in health service delivery, and you have a grassroots processes of triage, if you want, where those services that can be provided at the local level at relatively low cost are provided at the local level at relatively low cost, and you only reserve the more professional activities, more high cost activities for those areas where it's necessary. And I think that's kind of flipping over the service, but I think there you really have to look at communities as the primary, as a necessary element in service delivery, and with information technologies providing the platform on which that takes place. So
yeah, you picked an interesting one, the health sector, because in my experience, I've worked with a number of health organizations here in New Brunswick, and they tend to be some of the most conservative and entrenched in their ways, as I'm sure you're aware of. So I entirely agree with what you're saying. I think what you're talking about is long term, but I guess that's how we have to look at it, right? Because I think many of the things that we're really interested in and the changes we'd like to see, we're pretty aware that they're not going to happen in the short term.
Yeah, I think I think part of what we want to do here is to toss some visions out, some alternative visions of what is possible, or even what's necessary, and then see how to realize some of those visions. And
I don't know about you, Mike, but I read certain kinds of science fiction.
Yeah.
Because I find that actually pushes my boundaries out.
Yeah.
Think about just completely get out of the frame of where I am now, and what could be possible in the future. I entirely agree with you that we have to be really thinking far into the future, and I think when I think about that, I think about the need for certainly skill development, right?
Yeah.
We really want people to feel confident about using these technologies, which often doesn't happen in the communities that we're talking about, which can tend to be marginalized, and with people who maybe feel that they don't have a place in the mainstream or whatever. And so to try and make sure that people feel empowered to use the technologies in the very creative ways that they're capable of, I think is a real challenge that has to be addressed. Because ideally, if we are going to be talking about different visions for society from what we have now, we're talking about people making that happen. and and it's those people that are going to have those technology skills.
Yeah, and I think we're, as perhaps always, but there are contending visions of what the nature of society is, and I think it's important to see that a vision that's based on the collaborative use of technology, of people living in communities, is part of the the range of visions that are being presented, that people can see as being the basis for action, the basis for research, the basis for policy development. So anyway, thank you very much. It's been a very interesting discussion, and the discussion will continue.
Thanks, Mike.
Okay.